Hello guys. What's our today's plan about previous year question paper discussion?
In our previous discussion, we have completed 5 2-mark questions on August 2014 previous question paper. So let us discuss the rest of the questions today.
Okay, let's start from 6th question. Parallelogram law of vectors.
According to the parallelogram law of vector addition, if two vectors act along two adjacent sides of a parallelogram, having magnitude equal to the length of the sides, both pointing away from the common vertex, then the resultant is represented by the diagonal of the parallelogram passing through the same common vertex. One example of this occurs when the deltoid muscle contracts during shoulder abduction, the action of the anterior and posterior fibers of the muscle being compounded to work with the middle fibers and so vastly increasing their power.
The next question is third order lever. Lever is defined as the rigid bar, which moves about on some fixed point called fulcrum F. To perform an activity or a movement, the bone acts as the lever and the joints acts as the fulcrum F. Levers are of three types. They are first order lever, second order lever and third order lever. In third order lever, the effort lies in between the fulcrum F and the resistance R. These levers having mostly mechanical disadvantage. But the third order levers are seen plenty in the human body. Example in human body flexing the elbow.
Okay, the next question is Hooke's law of elasticity discovered by the English scientist Robert Hooke in 1660, which states that, for relatively small deformations of an object, the displacement or size of the deformation is directly proportional to the deforming force or load. Hooke's law states that the strain of the material is proportional to the applied stress within the elastic limit of that material. When the elastic materials are stretched, the atoms and molecules deform until stress is being applied, and when the stress is removed, they return to their initial state. Simply, Hooke's law states that the stress and strain are directly proportional to each other.
The next question is pelvic tilt.
The pelvic motion along with the hip and the vertebral column makes the normal sinusoidal curve in the gait cycle. These pelvic motions are called as pelvic tilt. These pelvic tilts may occur due to some pathological problems also. The pelvic may be inclined tilted in some ways. 1. Anterior pelvic tilt. 2. Posterior pelvic tilt. 3. Lateral pelvic tilt. 4. Pelvic drop. 5. Pelvic rotation.
Okay, the last 2-mark question is progressive resisted exercise.
Progressive resistance exercise (PRE) is a method of increasing the ability of muscles to generate force. Resisted exercise is often used to increase muscle strength. During the exercise, participants exercise their muscles against some type of resistance that is progressively increased as strength improves. Common equipment used for progressive resisted exercise includes exercise machines, free weights, and elastic bands.
Guys, we have completed August 2014 previous question paper. Tomorrow we will see with another question paper.
Okay, see you guys.